In this video, I'm going to share some of the uncommon signs of inflammation that many people overlook and explain why recognising them early could make a big difference to your health. Number one, cravings for ultra-processed foods. When the body is in chronic inflammation, there is a dopamine issue in that less is produced. Dopamine is a neurotransmitter that gives nerve cells the ability to talk to one another, and it is the major driver of motivation and focus, as well as allowing the brain to feel pleasure and reward. According to the BMA, 54% to 57% of the average adult's daily calories come from ultra-processed foods, and in youngsters the percentage is an astonishing 63 to 66%. In the United States, it's 55% in adults and 62% in children. What this ultra-processed food does is lessen the dopamine hit, meaning less pleasure is gained from regular foods. So a constant desire for highly processed, calorie-dense and hyperpalatable foods becomes the norm. There is also the theory of the protein leverage hypothesis, proposed many years ago by researchers Stephen Simpson and David Rubenheimer. The basic idea is this, and I quote, "Humans have a relatively strong biological drive to obtain enough protein. If the diet is diluted with foods that are low in protein, people may consume more total calories trying to reach their protein target." This hypothesis has support from animal studies and a growing number of human studies. Why ultra-processed foods are so problematical is down to a lack of quality protein, but also low fibre, food that is easy to chew, rapid digestion, high palatability, large portions and constant availability. Number two, loss of motivation. Even without the obvious depression, the reward centres of the brain can be affected by chronic inflammation. This is because a lack of dopamine. Now, this chemical is falsely called the pleasure chemical. It's not that, but it is the chemical, as I've just mentioned, that is involved in motivation, reward, and anticipation. When it runs low, the common behaviour is that it becomes very difficult to start an activity, hence the negative effect on motivation. So you may well have every intention of beginning to sort out that DIY job, or start a new recipe, or fix that car, or start to exercise, but never get round to it. And this is the dopamine issue at play. And what about getting away from those cravings for ultra-processed foods? How do you start afresh when the very condition you have is creating a barrier to make that change? Number three, sensitivity to everyday minor annoyances. Some individuals develop heightened irritability whereby minor inconveniences feel unusually frustrating. Noise, interruptions, or delays become harder to tolerate. Emotional reactions feel disproportionate. Researchers believe inflammatory signalling can influence brain regions involved with threat detection and emotional regulation. Number four, reduced stress resilience. A subtle sign is that people feel overwhelmed more easily than before. A workload that was once manageable now feels exhausting. Small setbacks trigger excessive mental fatigue. Recovery from stressful events takes longer. Inflammation can alter stress response systems, including interactions between the immune system and the hypothalamic pituitary adrenal axis, explained in the last video. Number five, heightened sensory sensitivity. Some people with chronic inflammatory conditions report greater sensitivity to pain, increased sensitivity to light, increased sensitivity to sound, greater discomfort from physical sensations. Inflammation can increase central sensitization, where the nervous system becomes more reactive to stimuli. Number six, gum disease. There's some argument as to which comes first, gum disease causing inflammation or inflammation causing gum disease. There is both occurring sometimes, but studies have confirmed that gum disease is the starting point for chronic inflammation on most occasions. Because this is localised, it's quite possible that the person with gum disease has no other outward signs of potential systemic inflammation, such as visceral fat or a poor diet. However, the psychological issues whereby people do not look after their oral health almost always comes with other bad habits that give rise to other inflammatory markers, such as visceral fat, poor sleep, lack of exercise, and so on. But you know who you are if you don't take care of your teeth and gums. And if this is you, please go to one of the many videos on YouTube that will give great advice that will greatly advance your oral health. So poor oral health hygiene alone can create inflammatory signals. What happens is that gingivitis, gum inflammation, or periodontitis, which is gum disease, encourages bacterial growth. The immune system responds to this situation and releases inflammatory cytokines such as C-reactive protein and interleukin-6. These molecules do not stay in the oral cavity but enter the bloodstream and start systemic inflammation. Periodontitis has been associated with an increased risk of cardiovascular disease, type 2 diabetes, rheumatoid arthritis, and general fatigue. The conclusion of this: if any of these 6 signs sound familiar, it may be worth taking a closer look at your overall health, even if you exhibit none of the more common signs. Thanks for watching. Please do like and subscribe, as it will greatly help me bring you more of my videos in the future. See you soon.